I'm Richard Knight, your moderator for this session. This session is the International Kidney Innovations Consortium. International organizations working in the space provide global perspectives. It is my pleasure to introduce a good AAKP friend and ally, Dr. Kamyar Kalantar Zadeh. He is past president of the International Federation of Kidney Foundations and World Kidney Alliance. I also had the good pleasure of participating during this past World Kidney Day on a panel in which he moderated. Dr. Kalantar Zadeh, I pass it on to you.
Hello, I'm Dr. Kam Kalantar or Kalantar Zadeh, a practicing nephrologist in Southern California. I would like to acknowledge and appreciate the American Association of Kidney Patients for inviting me to this important platform. And I would like to introduce some of the ideas about the International Kidney Innovations Consortia and also what we would like to share with you, and I ask for your feedback. So this is the disclosure of my financial relationships. I work with a number of companies. I represent the International Federation of Kidney Foundations and World Kidney Alliance. And this is the organization that has been around for almost 20 years and is one of the co-founders of the World Kidney Day, which I'm going to highlight. The World Kidney Day solidifies the importance of education and awareness about kidney health and kidney disease. It was inaugurated in 2006, some 15 years ago. This is the first paper that was published about why we need a world and why the world needs to acknowledge and celebrate the World Kidney Day. These are the themes of the World Kidney Day of the past several years. Every year, the World Kidney Day Steering Committee chooses one theme. For instance, the theme of 2021 this year is living well with kidney disease. If I have a kidney disease, I would like to live well and happy. As I said, the World Kidney Day 2021 has an important theme of living well with kidney disease by highlighting patient and care partner empowerment. And I'll go over this, what it is. So living well with kidney disease also includes the importance of quality of life. That means how kidney disease could have an impact on our daily living and the treatment that we receive, including dialysis and kidney transplantation and medications, the treatment satisfaction with the clinical outcomes that we are trying to strive. To advance research, practice, and policy, there is increasing recognition of the need to identify and address patient priorities, patient values, and patient goals. As you can see here in this kidney care chart, which was published a number of months ago in the Journal of Medicine, diseases. Both notion was earlier dialysis, the better dialysis. And then on top of the chart, you see the other option of never dialysis. We are here to talk about other options in between so that a patient with kidney disease, a person with kidney disease have different options and not to be a dichotomy. This is what I'm talking about, that the option of never dialysis exists, and this is within the context of the conservative management of kidney disease or supportive care. And this is usually to the conventional approach, which is earlier dialysis is better and is considered life-sustaining care. And we're here again to expand the options. And these options or choices are based on one keyword, hope. Hope is the feeling of trust. Hope is a feeling of expectation and desire for a certain outcome to happen. And hope is an important element when you have a chronic disease, in particular when you have chronic kidney disease that is worsening over time. Many patients who come to see me, they say that, doctor, I don't want to start dialysis, but I don't want to die. I don't want to think of dying. I want to live well. And this is the question that many have. And one of the studies out of many have highlighted something that we should have been well for a long time aware of that. That means patients' preferences, ability to travel, ability to work, to study, to educate, to socialize, and have less dialysis. And also at the same time, not suffering from problems such as fatigue, cognition issues, depression, mental health. So the World Kidney Day 2021 has the theme of living well with kidney disease, which includes different areas. But in the heart of these areas is a keyword: life participation. What is life participation? So what is life participation? It's the ability to engage in meaningful activities of life with having chronic kidney disease, work, study, family responsibilities, travel, sport, social and recreational activities, and it's even in a life situation. Life participation is broader than health-related quality of life. It's about life priorities and values with family members. And many patients have caregivers. They are actually care partners. And we often use the keyword caregiver, not appreciating that your caregivers are also your care partners. And the difference is that their life is also affected, but the life of the patient. So it's a two-way street for care partners versus a one-way street for caregiver. And the care partner is also affected by the kidney disease of the person. And therefore, the career goals and occupational and leisure aspects of life of the care partner may also, so they have every right to also want to be empowered in living well with kidney disease. Now, it's important for a patient and a care partner of a patient to have choices. And choice means to be able to choose between or among several options. Whereas traditionally, the choice is between two different approaches, and that would be dichotomy. For us to be able to team up with the patients with kidney disease, we must expand these choices, and we must go beyond and above dichotomy. And here I have highlighted conservative management, gradual transition to dialysis, not abrupt transition to dialysis, expanding palliative care, and also palliative dialysis. And these are options rather than dichotomy. Instead of saying either you are a dialysis patient 3 times a week, or you go to palliative care and path of end of life without dialysis, I would like patients to have 4 or more different options. And this is what we offer to them, including expanded use of palliative care. And this means symptom management so that no person with kidney disease would continue to suffer, if possible. And I would like to emphasize the important keyword, symptom management. And this path of palliative care is not the end of life path, but the opposite. I want to live happy and well with kidney disease. So therefore, while the kidney disease is progressing and while we are thinking of dialysis or kidney transplantation, the highlight would be preservative management. How I can slow CKD progression, how I can prevent or delay dialysis, not in a bad way, not in a way of palliative or hospice medicine, but in a way that is patient-centered, and also to improve patients' longevity. And even when a patient starts dialysis, I would like the patient to continue to have kidney function, native kidney function. It's called residual kidney function. And this is the incremental approach to dialysis, gradual approach to dialysis, once or twice weekly dialysis. While it's important also to offer the palliative options of no transition to dialysis or stopping dialysis, we need to highlight symptom management. And with that means a person with kidney disease should not continue suffering from fatigue, pruritus, other symptoms, pain. There is no reason for my patient to have pain while I claim that I have given you enough dialysis and you cannot complain. To the point that effective symptom management should be the main core target of our partnership of healthcare providers and the patients. So once again, that was one of the 4 areas of the living well with kidney disease. That means not having unpleasant symptoms of fatigue, pain, depression, cramps, restless legs, and nausea, vomiting, diarrhea, constipations. We should not have our patients continued suffering of these. And these symptoms happen very frequently. As you can see here, I'm going to highlight 2 studies for you so that you all know if you are a care partner of a patient or if you are a patient with kidney disease, you should not feel embarrassed having these symptoms. And as you can see here, another study highlighting Dialysis Symptom Index assessment, constipation, muscle cramps, feeling tired, dry skin, trouble falling asleep, and staying asleep. These are among the problems that I, nephrologists, have been trying to help my patients for the past 25 years. Patient kidney groups, as this one, renal support network groups, that has been also around for 30 plus years and working also closely with other patient groups. They always say something, look at here, dialysis is not our target. Dialysis is in order to live well. Don't live to dialyze. And I would like to once again reiterate the new approach to dialysis, which is incremental or gradual. And if a patient prefers that, if my patient prefers once or twice weekly dialysis, then I offer to him or to her. And this is what we have been doing in Southern California, which is now going all around the country and actually beyond the borders of the United States. That means starting or transitioning dialysis slowly and gradually. And we are thinking of this as an important theme because it's already being implemented. Mr. Alan Henry Nelson, who was with us until last year at this time, who chose dialysis as when he was 71 years old. And he lived well with dialysis. And he created a motto that dialysis means life. For him, dialysis was living well with kidney disease. And when a patient chooses dialysis or kidney transplantation, that must be it. That means we should continue suffering while I have chosen this or that kidney replacement therapy. So while we are meet with the World Kidney Day Steering Committee, we are also brainstorming different topics for 2022 as the main theme, such as engage, educate, and empower, the 3 E's. Or prevention of kidney disease, but some of these themes are not maybe quite. Who say prevention of kidney disease? What about millions of people who have kidney disease? If I say I want to prevent kidney disease, what about those who are on dialysis? If I choose conservative and preservative management of kidney disease without dialysis, and what about World Kidney recipes? I'm going to highlight a few of them. The International Federation of Kidney Foundations, which is also the World Kidney Alliance, and entertaining differences that are also relevant to the contemporary unmet need. So if you look at the themes of the past 15 years, are your kidneys okay? Is kidney disease treatable, harmful, your amazing kidneys? And now go all the way down to 2011, living well with kidney disease. I personally, I like engagement. Email me, contact me, and tell me what other themes you suggest, since I'm privileged to be co-chair currently, a co-chair or one of the 2 co-chairs of the World Kidney Day Steering Committee. And this is essentially what we do. We email, we meet. This is one of our meetings with the International Federation of Kidney Foundation and International Society of Nephrology, ISN and IFKF, the 2 co-founders of the World Kidney Day. We meet at least once a month, we brainstorm, and we try to see what would be the best approach for these and upcoming years. For instance, the World Kidney Day of 2020 was about prevention of kidney disease, prevention to detection to equitable access to care. Secondary prevention, that means if you have early disease, and then tertiary prevention, when you have advanced kidney disease, how we can help you not to get worse. I've highlighted nutritional therapy, the role of diet and lifestyle modification. And one of the areas I work with, for example, with my patients is about plant-based diet. That means eating Less meat, more plants. However, precision nutrition means that a given patient may have different needs. So one size fit all does not apply here. So once again, here back with the International Federation of Kidney Foundation and World Kidney Alliance, going over different options. And one of them is preservative management, how I can help people with kidney disease to preserve the kidney function, even when they start dialysis. And if they receive a kidney transplantation, how that can be preserved. And one thing that some people like me believe in is that medication is not enough. It has to be a combination of one and two. That means non-pharmacologic strategies such as dietary and lifestyle and CKD targeted therapies to achieve the greatest kidney and patient survival. The IFKF had in 2016, for instance, a consensus meeting about preservative and alternative aspects. And let me share with you two areas so that you know innovation needs to continue. So history have shown that prior to dialysis, bowel, your gut, could have been used as a dialysis membrane. Therefore, the question is, if a patient has diarrhea, does he or she need dialysis? I sometimes tell my patient, if you have diarrhea, you don't need to come to dialysis today. Or if you eat less meat, that replaces dialysis. Or if you make a lot of urine, you need today, for this week, maybe 1 or 2 sessions of dialysis. And another innovative approach, for instance, is to leverage perspiration and sweating in lieu of dialysis. And smart colleagues such as Dr. Keller has come up with this idea, or reinvigorated the idea. And we need to team up again to examine these and other options, not just dialysis and kidney transplantation. So once again, International Federation of Kidney Foundation and World Kidney Alliance is here for you. Please email me and contact me what other ideas you have, what other expectations you have. And I would like to mention 1 or 2 slides about the World Kidney recipes. Eat smart, eat well, enjoy life. We are not here to tell you what not to eat. We are here to help you, to tell you what to eat. That's enough with telling you can't eat this, you can't eat that, this has potassium, this has phosphorus. Let's team up to create World Kidney recipes, a collection of renal recipes from all around the world, across all different cultures, so we all enjoy together. And we have advanced plant-dominant, PLADO, or PLADO diet, plant-dominant diet. That means a diet that is mostly from plants. It's not vegan or vegetarian, it's mostly from plants. And I also try my best to adhere to this diet, because if I want to tell my patients to do something, I need to be able to do that myself. Otherwise, I will become a disconnected nephrologist or disconnected dietitian. And here, examples of our new project, World Kidney Recipes, Eat Smart, Eat Well, and to be inclusive of different expectations, different cultures, to make it fun to be a kidney disease patient and to be inclusive. These are colleagues from Hong Kong who have highlighted their kidney recipes, what we can eat and enjoy, not what we cannot eat. Why? Because when diet is wrong, medicine is of no use. No disease that can be treated by diet should be treated with any other means. In summary, World Kidney Day Steering Committee has chosen 2021 to be the year of living well with kidney disease. Despite COVID pandemic that has affected many aspects of our life, indeed more reasons to choose living well with kidney disease so that patients with kidney disease and patients' care partners are not forgotten in the midst of COVID-19 pandemic. Living well with includes patient and care partner empowerment, empowering patient and care partners, life participations, patients not suffering from unpleasant symptoms, and patients with CKD and their care partners should feel well and supported through concerted efforts by kidney care communities. And we are thankful to American Association of Kidney Patients and other patient organizations for making this happen. You guys are very strong. The US Congress listens to you more than listening to me, the nephrologist. And we team up together with you, with kidney foundations, with patient groups, professionals, to work together to also find important themes for the year 2022 World Kidney Day and beyond. And I would like to acknowledge people where I work at the University of California, Irvine, where I'm privileged to be the chief of nephrology and working with 20 plus nephrologists and many healthcare providers. And please share with me your thoughts. You email me and visit my social media. I would like to know what you think about the themes of the 2022 and subsequent years for the World Kidney Day. Thank you, and I thank American Association of Kidney Patients for giving me this opportunity to present today. Thank you very much.
Thank you, Dr. Kalantar Zadeh. That was a very insightful presentation. I particularly enjoyed the concept of preservation management and the notion of incremental transition to dialysis. We think that is something whose time has certainly come. We look forward to learning more about that.